ends. We want to hear from you in the chat. Please remember that we are using the Pathable platform for our chat, as opposed to using the Zoom feature for chat. And please do feel free to ask questions or make comments. We recommend that you keep yourself muted unless the presenter asks you otherwise. And without further ado, I am excited to announce and introduce Stephanie Wolf, who has a bachelor's degree as a registered nurse and is currently employed by the Kansas Department of Health and Environment as a maternal and child health perinatal consultant for the Bureau of Family Health, coordinating maternal and child health services at the local level for the first 16 years of her career. Stephanie serves as the KDHE representative on the Kansas Maternal and Child Health Council, as well as on the Kansas Maternal Mortality Review Committee. She's active in the March of Dimes, serving on the State Program Services Committee and initiating a perinatal community collaborative project that has gained state and national recognition. In 2015, Stephanie accepted the position as state coordinator for the Kansas Perinatal Community Collaboratives, utilizing the March of Dimes Becoming a Mom curriculum. In this position, she has worked tirelessly to develop an infrastructure that supports local communities with implementation. Stephanie has been instrumental in work with state and local partners to identify and bring together needed resources around Title V priorities, including tobacco cessation, mental health, maternal morbidity, and mortality, preterm birth, infant mortality, safe sleep, breastfeeding, and oral health. Her ongoing work has included authoring integration toolkits for use by maternal and child health providers across the state. And Stephanie is passionately devoted to her family, community, and her career in public health. And today is Jill Nelson, who joined the Bureau of Family Health as a perinatal infant health consultant from the Junction City, Geary County, where she helped to build and lead the Delivering Change, Healthy Families, Healthy Communities, Perinatal Community Collaborative Initiative. As a parent, Jill holds a deep passion and interest in improving the health of mothers, infants, and families in the state of Kansas. Jill holds a bachelor's degree from Kansas State University, and she and her husband, David, are parents to Isabel, Kyle, Emily Lynn, and the late Luke Nelson. And without further ado, Stephanie Wolf and Jill Nelson, I'll hand it to you.
Sorry about that. I didn't realize I'd gotten muted again. So thank you, Morgan, for the introduction. Again, welcome all of you to this afternoon's presentation on the home visitor's unique role in maternal warning signs. We will start with a quick high-level overview and recap for anyone new to the audience. So for anyone who did participate in our kickoff webinar or last month's lunch and learn or lunch learning session for MCH, yeah, I apologize. There will be a few slides that will be a little bit of a review for you all, but we want to make sure everybody's kind of starting at the same place here today. We will have time for questions, comments, and discussion at the end of the presentation. So Jill and Morgan will be monitoring the chat, and at that time, we would definitely encourage you all to unmute and join in some discussion. So we'd also like to thank our state partners and national partners who have collaborated with us on this initiative. So the Maternal Warning Signs is a state-led initiative that was launched in July of 2021. We launched the initiative with a kickoff webinar that we hosted along with our state and national partners, where we all kind of presented on a lot of the background information that led up to the launch of the initiative, which was in response to data, findings, and recommendations from the Kansas Maternal Mortality Review Committee. So there's a lot of that background information that is in that kickoff webinar. I'll be showing you the location to where you can access that webinar here shortly in the presentation. And that's a place where we really encourage you all to start if you're just joining the conversation now. As again, that's going to give you a lot of the background that we're not going to provide today because we've already provided it through that other opportunity. The goal of the initiative is to educate providers, perinatal persons, family and support persons about the urgent maternal warning signs. And we hope that this is going to lead to a decrease in the maternal mortality rates in our state. Again, we are doing this in coordination with other state partners, one of which is the Kansas Perinatal Quality Collaborative's fourth trimester initiative. So some of you maybe have heard of that and are aware of that being implemented in your community through the birth facilities that are enrolled. So why focus and inclusion on maternal warning signs? Well, as you know, KDHE, MCH, the big umbrella MCH, that's inclusive of all MCH programming, is committed, as you are at the state or at the local level, to supporting healthy pregnancies and deliveries for every woman. There are national campaigns, two of which are CDC's Hear Her campaign and AWHONN's post-birth warning signs, that supports our efforts to prevent pregnancy-related deaths by sharing potentially life-saving messages about the urgent warning signs. And we're going to talk more in depth about those here shortly. The premise at the foundation of these campaigns is that women know their own bodies better than anyone, and they can often tell when something does not feel right. The campaign resources, excuse me, I need to raise my monitor so I can see my slides. It's not going to. Oh, here we go. Campaign resources provide messaging that encourages partners, friends, family, coworkers, providers, really anyone who supports that pregnant and postpartum woman to really listen when she says something doesn't feel right and to act quickly on that. So, our approach is really to have this cross-sector repeat messaging. While we're approaching and training all sectors on this initiative, so reaching out to the inpatient settings, birth facilities, trying to engage them, including emergency departments and first responders, as well as outpatient clinical providers, we want to focus today on your role specifically in the public health sector as a home visitor. So that is where we're going to really kind of stay focused initially or throughout today, but we initially wanted to share that this is, a cross-sector initiative. So your role as a home visitor. As a home visitor, you play a critical role in eliminating preventable maternal mortality. One part of the solution is to really hear women's concerns during and after pregnancy and engage in an open conversation to make sure any issues are adequately addressed and that appropriate referrals are made. So we're going to really hone in on this a little bit more in the next slide. We want to listen to pregnant and postpartum women, even listen to them if they experience the concerns. When individuals are engaged during their home visit, it can lead to greater buy-in and follow through. So we know everyone has an agenda when they go in on that home visit. We've got a lot of education to cover, and we're adding one more talking point here. But it's going to be really, really important to include, really this life-saving messaging in the education that you're providing, and also really engaging them in that conversation and really listening. As you begin to provide the education, they're going to start sharing with you things that they're feeling and experiencing. It's going to be really important to hear that and to act on that, and to help your clients and their support persons understand these urgent maternal warning signs and the need to seek medical attention right away. So again, just honing in a little bit more into your unique opportunity as a home visitor. You have a very trusted, you are seen as a very trusted and caring individual, and often have an established rapport with the individual, with their family, through the uniqueness of your services, often that you have been building a relationship over the duration of the pregnancy and have this rapport built. The length of the home visit alone provides, time for focused messaging that often in inpatient or, in a clinical setting, providers don't have that kind of opportunity. They just don't have the time when, appointments are booked 15 minutes apart. The subsequent visits that many of you as home visitors have the opportunity for. Now, I understand, sometimes it's a one-time prenatal, one-time postpartum if we're lucky, but we know that there are a lot of programs out there who do have that opportunity for multiple visits throughout the course of the pregnancy and the period postpartum. So those subsequent visits allow for repeat messaging, and we're going to share some resources that can be utilized to provide that repeat messaging throughout that duration. You also have a very unique opportunity to engage support persons in the home environment. Whether it be a home environment or maybe some kind of a neutral setting where you meet for that visit, it provides a very different opportunity than the more clinical setting, whether it be inpatient or in, a provider's clinic. So that's a really unique opportunity. Often there are multiple family members present that can be engaged in that conversation and that teaching opportunity. Whereas often, again, when somebody's going in for a visit, all the family's not there, or not as many as would be in that home visit environment. And especially now with the COVID restrictions, they're limited to one additional person. So again, just a really unique opportunity that we want to engage in. So the initiative implementation has been a phased approach. We started with the KDHE kickoff webinar that I mentioned was back in July, which is available to all of you to view. If you have not or did not participate in that, you can access that through the Maternal Warning Signs Integration Toolkit, and the URL is here on this slide. The slides have been uploaded to the platform, so you can access that there, but you can go into that, and I'll show you here in just a moment what that's going to look like when you go into it. But again, we really encourage everyone who has not participated in that kickoff webinar to start there to get all of that background information. Then there's the Maternal Warning Signs Integration Toolkit. And again, we're going to go to that momentarily so you can get a look at that. But that's where we're sharing all of the resources that we've developed for this initiative with all of you. Again, across sectors, just really anyone who has that opportunity to connect with a perinatal woman will have access to those resources. And then we have the A1 post-birth warning signs education program, which again, we're going to speak to more here in a moment. So just want you to see that it's been a phased approach. These different components are available, and we will continue to kind of roll this out. As we move forward here, you're going to see kind of what that's going to look like. So here's the Maternal Warning Signs Integration Toolkit webpage or website. Here's the home page for it. You'll see here that there are resources, and you'll want to go to the provider resources where you can see a long list. It's quite extensive. There's more than this. This is just a screenshot of part of the page. But here at the very top, you'll see the Maternal Warning Signs Initiative Kickoff webinar. So this is what I have mentioned multiple times now, being the starting place where we'd like you to go to view that webinar. It is a 2-hour webinar. It is hosted through Kansas Train. So when you click on the link there on the Integration Toolkit webpage, it will take you directly to Kansas Train if you already have an account. If you don't, it will prompt you to create an account. There's no cost to the Kansas Train accounts. And there's multiple learning opportunities on there. So this is where you can access the webinar. Additionally, under the provider resources, you will see there on the left-hand side of the page, down towards the bottom, is where the A1, which is the Association of Women's Health Obstetric and Neonatal Nurses, where their education program is available. You'll see a note there that says to learn about eligibility and accessibility of the A1 education seats and implementation toolkit funded by Kansas Title V, email your inquiry to kpcc@ks.gov. Limited number of funded seats are available. So I mentioned that we're implementing in phases. In this first phase, that we have been able to provide some funded seats to KDHE MCH, to McV, to our Kansas Perinatal Community Collaboratives, and to our the partnering Kansas KPQC's fourth trimester initiative birth facilities. So I'm going to speak to the seats more in just a moment here, but for any of those that are in this phase 1, I just want to take a quick opportunity to remind you of some approaching deadlines. The MCH, Aid to Local grantees, your deadline for completing this training is October 15th, which is quickly approaching. If you know nothing about this, but you know that you receive MCH Aid to Local funds, please check with your supervisor for access to the training seat that was provided to your agency. For any McV sites, your deadline is January 15th, and more messaging or additional messaging on this is on its way. So between Morgan and Jill, they're going to be getting a lot more communication out to you on this. So for anyone who was not listed here in phase 1, know that there is a phase 2 in the works. This is going to be where we try to add in some additional KDHE funded programs. We're trying to work with funding cycles for the different programs to be able to purchase some of these seats. For non-KDHE funded entities, you have access to all of the toolkit resources here that you see. So everything we've developed is here available to you, as well as you can go on to A1's site here. Again, you just click on the link here on the in the toolkit, and you can purchase your own seat. So whether that be an individual chooses to purchase a seat or an organization, a large organization, for example, maybe Parents as Teachers decides they want to push this out amongst all of their programs, they could work with A1 to do like a group purchase of these seats and get them at a discounted cost. So, if there's question about that, again, you can email us. I do want to make note that the training seats, the purchase of the seat really pays for or includes one CEU, one contact hour for licensed professionals. So that doesn't mean that that seat is limited to one individual. What we're really encouraging is that, of course, your licensed staff who might want that CEU be the registered participant that pays for the seat. But then you have access to that online seat for the remainder of the next year. And we really encourage that you utilize that training opportunity and that seat to train additional staff. So really anyone in your organization or in partnering organizations, that they be able to use those seats more broadly to get additional staff trained. We really do want anyone who's going to be in contact with perinatal women within the organization to be trained on the initiative, and again, kind of that background, the language, really develop that understanding behind it. So just to speak a little bit more to what's available to all of you, whether you're KDHE funded or not, again, you have access to the website and the toolkit that resides on it. Again, this is just a glimpse of the provider resources. There's additional ones. Most recently, Jill just uploaded social media messages. She converted all of the infographics and the PDFs for patient education. They've been converted into JPEGs for your use through social media, and also some social media messages that have been developed around those. So that's a new section that's available, as well as a plan for implementation, which I'll come to at the end. So those have been added as well. Here, I just really wanted to highlight there in the middle, the Maternal Warning Signs Comprehensive Patient Education Resource Package. So this is where all of the handouts are there available as PDFs for your download in English and Spanish for your use to print and provide as patient education handouts. We are going to speak to these kind of more in a broad sense, and then kind of use of the different ones, but I'm not going to pull each of these up during today's presentation to show you. So I really encourage you following this presentation, if you're not familiar with these already, to go to the toolkit and take a look at all of these. There are some really great resources. There's all kinds of additional resources here, magnet templates, links to, for example, the Kansas Maternal Mortality Review Committee, to their report, and different infographics that are available. So it really, provides you with that snapshot view of kind of the case for the need, or the reason to why maternal warning signs is so important here in our state. Lots of other great resources available there that I don't have the time to review today. So just really encourage you to go there and take a look. Okay, so what I want to dive into here just a little bit more is that education packet. It's a comprehensive selection of patient education materials from the national campaigns, as well as those that have been state created or adapted. The messaging on the maternal warning signs includes both physical and emotional symptoms. We worked really hard to expand the content on the emotional symptoms. It's again aimed at providers, pregnant persons, and their partner and family audiences. It's identified for use with unique patient and provider needs, and intended for use across all sectors and settings. So I'm going to really dive into that piece here momentarily. And it ensures consistent and repeat messaging. I'm going to show you an image here. So just quickly, on the right-hand side is an image of the front of the guidance that goes along with all of the resources. We're going to take a closer look at that table here in just a moment, but I did want to show you an image of the handouts themselves. So this is what we put together as a like a provider's teaching guide. So again, the phase 1 implementation, we were able to provide these to our KDHE funded programs that I identified for phase 1. We've laminated them and sectioned them off according to kind of the time frame that you would use them in. So I just wanted to show an image of this. Hopefully this looks familiar to a lot of you. Hopefully you've received your copy. For others, again, these are all available for you to download and print. Again, the handouts are intended to be used with your individual clients or patients, but this is a screenshot of the provider's guide, again, that we've laminated just for quick use while you're teaching. So this is just certainly something that your entity could do as well if you're not a KDHE funded program. This was pretty easy to do and has been pretty user friendly from what some of the feedback I've been getting, and we look to receive more feedback at the end here today. So this is taking a closer look at that guidance document. So this is the table that is within it. You'll see here that all of the different patient education handouts have been kind of identified for targeting a different population. So whether it be client or patient focused, or if it's support person or family focused, and then identified for a different period. So whether it be prenatal, postpartum, or that entire perinatal period. So those are all color coded. And then across the top here, going horizontally, you'll see the different kind of opportunities for use. So In this first column, we've identified those that are ideal for a brief touch point. So if it's maybe a routine clinic visit, that visit that I mentioned is just a quick, maybe 15-minute visit, depending again on the time frame. If they're prenatal, postpartum, they've been identified by the color, but you'll see the check boxes for those that work well in that kind of a situation. We've also identified those who are great for repeat messaging or in use in combination with each other. So again, as a home visitor, if you're having subsequent visits, you have a great opportunity for that repeat messaging. And so really any of the ones throughout that perinatal period there, or who that are speaking to the urgent warning signs can be used in combination with each other. The only ones we didn't include those are the ones that are pregnancy specific, which are the signs and symptoms of preterm labor and count the kicks. If you have the opportunity for that longer period of engagement, again, through home visiting, or some other kind of case management program, possibly prenatal education, we've identified those that, these are the ones that are a little more comprehensive or extensive that are good in that kind of a setting. If you are working with someone with a lower comprehension or education level, we've identified those resources that work well in that situation. And then also those that work very well with a higher comprehension and education level. And then we have one that was designed specifically for the low literacy population or those with a language barrier. So this is really all images. We were excited to be able to provide that. All the handouts are available in English and Spanish, and then you will see the asterisk there represents the A1 Save Your Life handout, which is available in multiple other languages on their website. So, and again, that's all linked from the Maternal Warning Signs toolkit. So this is the back side of that guidance document. It just gives you a little more of a description of kind of that ideal use and opportunity. So you will see that there's a column that just describes the purpose of each one of the different handouts or resources, kind of what the handout is speaking to. The next column speaks to who should use this. You'll find that a lot of them are geared towards anyone and everyone should be using this. You will also see those handouts that we have identified to work very well in like a home visitor setting, or where there's a case manager, a doula, some kind of a patient educator that again has that greater opportunity to expand on the resource. We've also identified kind of what settings that they're most useful in. Again, you'll see a number that can really be utilized in any setting. And then we'll identify those that they're better used in a home visit environment, maybe a prenatal education class, or maybe that initial OB visit where there's more time spent with the patient to kind of do that orientation to their prenatal care and cover maybe their OB packet where they're given different resources. So again, just an opportunity where there's greater time spent reviewing the resource. And then you'll see those again that are identified for any setting where the opportunity to engage partners, family support persons, any setting where that opportunity presents itself. So again, that most often happens in the home visit setting. Then we have a few tips for ideal use. For example, count the kicks is pretty specific to a particular time frame, ideally the third trimester. We encourage that you encourage and assist them to download the app that is used with those resources, and then encourage that there be follow-up on this during subsequent visits. So again, just some helpful little tips there. Another example of this is, it's ideally used where and when there's opportunity for review and conversation about the resource. So again, these are resources that are a little bit more comprehensive. There's a little more content on them. And then there's those that have been identified again for that low literacy level, language barrier, where there's a very brief encounter, or we're just going to use that as a reminder, kind of a repeat message opportunity. So, so anyway, that I know there's a lot of information there, but hopefully it really helps you to identify really what resources is best used, where and with who. And again, just want to reiterate, as a home visitor, likely you have the opportunity really to use every one of these. Again, one of the big goals with this is that we have repeat messaging. We know that individuals need to hear something 7 times on average to have that sink in. And so that is really the goal with this initiative. So I just kind of wanted to wrap up here before we move into an opportunity for discussion to kind of just share with you the plan for integration into maternal and child health services that we've developed. It's just, it's very brief. It's pretty simple and straightforward. It's just been added to the toolkit. But the purpose of this is really to focus on, really getting this embedded in your services. And so we focus on learning, informing, and institutionalizing. And so under the learning step, it's, this is part of that, just that you learn what the initiative is, you participate in the trainings that we have available, which is that kickoff webinar, also the A1 education program that's available, and that you go out and access and review all of the resources that are in the integration toolkit. So you're learning and really familiarizing yourself with the resources. The next step is to inform. We want you to take these resources and educate those around you. So other providers, whether it be in your organization or with partnering, other community, agencies and organizations that are also interfacing with the perinatal population, patients and clients, obviously. And then also, as we talked about, the family and support persons that you have the opportunity to engage in your services. And then there's also that community sector that we need to reach. So again, with the social media messages, the CDC Hear Her campaign that is linked from the toolkit also has a whole section on community engagement. And so there's PSAs and that kind of thing available. And then the third step is really focused on institutionalizing this. We encourage you to, work with your supervisor to develop policy and procedure around this that assures that these implementation steps occur within your organization, your healthcare system, so that following this initial kickoff and all of our implementation efforts, this training is still included. So it's part of your orientation process for new staff. So every new staff that are coming on, or staff moving into these positions, are being trained. And that you're identifying appropriate educational opportunities for each service or program area within the organization. You're designating staff responsibility and the dose and frequency, what your documentation process is. This is what inevitably ensures that the education happens, and that it happens, long term moving forward. These maternal warning signs, the maternal morbidity, mortality, this isn't going to go away. This is something that that we've needed to have in place for a long time. And so this is really going to ensure that it's established and just becomes part of your workflow, like safe sleep and breastfeeding education have been for years. So at this time, it looks like we've got plenty of time for discussion around the topic. Again, I recognize we have a mixed audience. So I know we have individuals who have been familiar with this since the kickoff, maybe are a little even little experienced, hopefully, with this, have hopefully already participated in the A1 training, have received their laminated copy of the of the handouts that they can use as a teaching guide, and might want to have some discussion around utilizing those resources. And then I know I have those of you who are hearing about this for the very first time and may have questions about next steps and how to go about getting this implemented within your organization or your role. So please feel free to unmute yourself at this time, or Morgan and Jill, if you've noticed any questions or comments in the chat.
I haven't seen anything in the chat stuff, but I did drop in the link for the toolkit.
Oh, thank you.
So that they have that link in the chat. And then I also told the McV sites that they will be getting their laminated packets here soon. We'll get those in the mail, and that they'll also get follow-up information on how to access the A1 training seat as well. I don't know if we have any questions right now, but I was wondering, Steph, I was thinking maybe it would be helpful to talk about, just briefly go over, we talked about Count the Kicks in particular, but maybe what the other sheets are in the patient education packet, just a real brief overview of what all is discussed.
Sure. Let me, if you can all bear with me actually as I transition here. I want to stop sharing this screen. I'm going to do a new share, but I need to pull it up. We'll take a quick peek at each one of the handouts really quickly since we have the time. Bear with me for one moment. Okay. Whoops. Sorry, I had it and I just lost it. Let me grab it again. Here we go. Okay, I just need to reshare here again. Whoops. Okay, are you able to see?
Yes.
Okay, let me reduce the size a little bit so you can see the whole handout. Okay, is that better? Okay, so you'll see here, again, this is that guidance document that I've already reviewed. Here is the handout on preterm labor. So we did throughout these materials try to, while working with the original source and the adaptations we were allowed to make, we did with the design try to get them all to kind of follow a similar flow. Also coloring the color scheme as we were able to. We utilized a process through a CDC tool to really kind of call out the key message at the beginning, which of course is that preterm labor is, labor that happens before 37 weeks and this could lead to serious health problems. And so then, what are the warning signs and what you need to do about it. So kind of that type of a flow and then linking them to a resource. So this is the preterm labor one. Again, English and Spanish. Here is Count the Kicks. So again, we utilized Count the Kicks resources, but tried to kind of reformat that to kind of follow that same format or flow. Probably a lot of you are already familiar with their resources. but this is the one that we created for this specific toolkit. And in Spanish. Here is one of the CDC resources. So again, this one, as you can tell, there's a lot of content in here. So this is one that's identified for use, more in a home visitor setting, maybe someone a little bit higher comprehension level. Certainly probably not going to be effective with a low literacy or a language barrier. But one of the things we really love about this resource is that there is the bottom panel that is a guide to help an individual start a conversation with their provider. So it kind of goes through the warning signs, a checkoff list, and then you as a home visitor can actually, kind of walk through them with a sample conversation that is laid out here in this guide. So we felt like that was really helpful. And again, in Spanish. This is the one that can be used with anyone for repeat messaging, but was designed specifically for the low literacy or populations with a language barrier. So this was initially taken from ACOG, the ones that developed the AIM bundles. They had a similar, but it didn't have specific instructions around calling 911 or calling their provider. So again, we kind of blended some different resources to come up with this, but you'll see the images there and then the instructions. There is verbiage on this, there's wording, but for an individual who can't understand that, they should be able to see, again, in the opportunity where you have a home visitor that's able to kind of talk through this and describe each of these symptoms that it's speaking to. Hopefully that that image is enough of a reminder to them that, oh yeah, I'm supposed to call my provider, or this is something I need to call 911 about. This is the resource that may look a little familiar to you. We've been utilizing this resource from the Eunice Kennedy Shriver Foundation for years. And with their permission, we reworked it a little bit, tried to condense it and simplify it a little bit. But this is focused on the emotional symptoms that were not as included in the CDC and AWAN's materials. So we wanted something that was a little more extensive there. This follows that stoplight kind of, red, yellow, green. So if you can have that kind of discussion and dialogue with them, give that as an example, that helps them follow through that. This is the AWAN kind of signature resource that they have. It's the Save Your Life. They have these magnets available again for our funded sites. We purchased magnets and those were shipped to you. We also have the magnet templates there in the toolkit. For anyone who's not a KDHE funded entity, you're able to print your own magnets. I think often magnets are something that are held on to when the papers are not always. So anyway, again, the idea of this is that they use that post-birth acronym to identify what the symptoms are. So using that post-birth acronym, I think is pretty appealing and can help somebody remember. But again, there is quite a bit of verbiage on this handout, so it's maybe not as ideal with the low literacy population as the one I showed previously that is more image focused. And this one is the one that is available in multiple other languages on the website. Here's another CDC resource. It is geared towards family and support persons. And again, provides like some conversation guide, for that family member support person to have with the pregnant or postpartum woman. And again, this is something that you can really talk through with them and engage them in that during a home visit. And then here again is one of those Eunice Kennedy Shriver Foundation materials or resources that we, with their permission, reworked to fit the design of this toolkit. So, talks about those emotional. This one again is geared towards family and support persons. So again, just calling out the emotional concerns, being prepared, watching for those signs and offering to help. It gives some talking points here as to what they can do to call attention to it with their partner and offer help, and then what to do and resources there. Whoops. Okay, I guess that was it. That was the last one. So is that what you were thinking, Jill, or?
Yeah, I thought it might be helpful for them to just know what all was included in the packet. I know it was kind of hard to read on the one sheet where it's all summarized. So just a high level of what's all there.
Yeah, and Beans, okay, so are you guys able to see my PowerPoint now? Again, okay. What I may actually do now, are there any chat questions or any discussion? Please, anyone jump in. I'm gonna go and pull up the maternal warning signs. Here we go. The actual website. Are you able to see that now, or are you still seeing my PowerPoint?
Nope, we can see it.
Okay, great. So this is the toolkit. Again, I've already gone to the provider resources, but there's, let me just go back out a page or two. So here's the home page. So there is the statement of need, the call to action. So again, giving some of that background information and linking to some of those reports from the KMMRC, the Maternal Mortality Review Committee. So all that is available there for you, but then the resources. And again, there's resources. We've divided them down here for all the different groups, but we've been focused on the provider resources here today. So you'll see those. Here are the social media resources that I was talking about that Jill had developed and gotten posted. Magnet templates, the Save Your Life that I showed you. We also have preterm birth. I'll just click on these really quickly so you can see them. Here's the whoops. That's not the one I meant to show. Huh. Oh, I see. Sorry, Jill, we're gonna have to talk to Jeff. I see that those go up a line. Here, let me try this. Okay, so here's the preterm birth, preterm or signs of preterm labor symptoms. So here's a magnet template for that. And then soon we will have Count the Kicks one available as well. Just very quickly, a few other resources here. Again, all of the AWAN resources are available. CDC, the KPQCs, their 4th trimester initiative that I mentioned, that's kind of a sister component to this for the birth facilities. Is there. The Kansas Maternal Mortality Review Committee, their reports and infographics that again provide all of the background data that was behind this initiative is available. There's a CUF project from the Preeclampsia Foundation that we're working on, trying to bring to the state, but again, anyone can go here and bring that to your organization. Kansas Connecting Communities, probably a lot of you are familiar with their work, and this is where they're providing support to providers for mental health services. There's a toll-free consult line and a wealth of other resources available through them. Our integration toolkit, so the Maternal Warning Signs is just one of those, but we have multiple other ones available there, including a mental health, perinatal mental health toolkit that hopefully a lot of you are familiar with. If not, we really encourage you to go there and utilize those resources. There's action alerts and infographics for different awareness months. Again, many of them tied to the maternal warning signs. There's birth care equity resources, as well as IRIS, so assisting with that integrated referral system. So lots of different resources available here.
I don't
Jill, how do
see
you feel
anything.
about me dropping your contact information in the chat so
Oh,
they can send
so-
you emails if they have questions after this?
Actually, yes, you can put them in the chat and I have them up here on screen. Can you see the slide now?
Yes.
Okay, so I recognize not everyone is a KDHE entity, so I did want to include KDHE contacts. So again, Jill and I are overseeing the large maternal warning signs initiative. But Carrie is really the contact person for any MCH grantee, and then Morgan for our McV folks. So really reach out to any of us and we will help you however we can, or get you connected to the other individual that might be more fitting. So.
All right, well, if there are no other, oh, sorry, go ahead, Jill.
No, I was just saying, I didn't see anything else. I didn't see anything in the chat.
Same here. So thank you guys very much for attending today's first day, day one of the Kansas and Visiting Conference. And thank you to Stephanie and Jill. Absolutely, we need to have these maternal warning signs be a constant in our minds. So thank you guys very much, and we'll see everyone back here tomorrow at 12:30. Enjoy the rest of your afternoon, everyone. Thank you.
Thank you.